Okie dokie. So, so today we're going to be talking about let's ditch the itch. So in veterinary practice, itchy dogs and itchy cats a little bit less so is the most common problem that we see, and it can be incredibly frustrating for us as vets to deal with for various reasons, and we'll share that. And I'm sure I'm just extrapolating to the vet shops, but I'm pretty sure that you guys have this conversation on a daily basis with your clients coming in saying, my dog is itchy, what should I do? And it's probably even more frustrating for you because you have less tools than what we have as vets. So the whole point of this talk is just to try and give you some things that you can tell the client and educate them somewhat so that they know where to get help for the itchy pet. And what's very interesting is that people think that they can deal with this itch on their own a lot of the time. So by the time they get to us, they have tried sometimes up anything from 6 to 10 different things. And so they're really frustrated by the time they've gotten to us. And they are also have already spent a lot of money. So then it's quite difficult to manage the case. So we really need a team effort from frontliner staff and from our vet shop staff as well to try and get these animals to us as vets as quickly as possible, so that the animal doesn't suffer all that long, but that the person doesn't get so frustrated and that they don't waste their money along the way. But it should all make sense why I say that towards the end of the talk. So let's see. Right. So if we look at causes of itchiness, we're going to teach you some big words today. The big circle here in the middle, pruritus, that is the medical scientific word for itchiness. So it just makes vets sound smart when we say pruritus, but if you ever come across that word, it means itchiness. And you can see that there's a huge number of causes that can contribute to the pet being itchy. And not all of it's allergies or mites. A lot of people will come in saying, my dog's got mites, or it's got mange, or I think it's got fleas, or it must be allergic to the food. You know, they could come in with those common things, but there's a whole other range of other causes. And this list over here is certainly not all of them, but these are the more common ones. And the most common causes of pruritus or itchiness are fleas, food, and then we're just generalizing allergies or atopy. So we're going to prefer to use the word atopy or atopic dermatitis. So what that means is allergies towards things in the environment. And that's quite challenging because it could be anything from dust mites to pollen to grass seeds to fungal spores in the ground, to sometimes cats, plastic bowls, the detergent that you use to wash your floor. You know, the list is kind of endless as to what allergies could be. And to make things more complicated with allergies is normally the animal's allergic to more than one thing as well. So we need to bear that in mind. So the top 3 causes of itchiness, and this is something that I tell my clients when they come in, would be atopy, allergies to things in the environment, fleas, and food. But as vets, when we see that patient, we need to make sure that it is those common 3 and not something else that we're dealing with. Okay, so if we look at atopy first, or itchiness, sorry, this is itchiness in general, which dogs can be affected by itchiness? It's basically any dog at any time can be affected by itchiness, although there are some causes that are more common in some breeds than in other breeds. So atopy, or that allergy to environmental things, it's quite common in our Jack Russells, our Yorkies, Pit Bulls. Those will be kind of top of the list. Labradors as well, quite common. And then seborrhea is another cause of itchiness in dogs. So that's basically the dog produces quite an oily layer on its skin, and that it's an excessive oily layer, and that predisposes it to getting infections, which then make it very itchy. So kind of the poster child for seborrhea is miniature schnauzers and Scotties, although there's lots of other breeds as well. Then when we get to our collies and our German Shepherd dogs, GSD is German Shepherd dog, autoimmune conditions can play a big role. And then we're looking at things like collie nose, German Shepherds get sebaceous adenitis, all sorts of other things. So it will also cause itchiness. And then lupus is also quite rare, fortunately, and also an autoimmune disease, and that affects German Shepherd dogs. And then you get some problems that are more common at certain ages. So puppies are more likely to get mange than an adult dog, and that's because their immune system is not completely developed. So it's very rare to get mange in a dog older than a year. So that's also something that you can remember. If you have a client coming in with an adult dog saying, oh, it's got mange, I want dip, you can pretty much say it's extremely unlikely for a dog older than a year to have mange, unless there's something else going on with the dog. So that'll be another reason to get it to the vet. And then food allergies, interestingly enough, tend to happen when the animals are older than about 3 years, anything from a year old onwards. So again, if an animal comes in younger than a year, it's the very, very rare case that it would have a food allergy. Unfortunately, they don't all read the textbook, so it doesn't all fit into this perfectly. So just because a Jack Russell comes in with itchy skin doesn't necessarily mean it's got atopy. It could have something else. So it's just these are the more common ones that we see. And it can look like anything. And I know that often people will bring in their phone with a photo of the animal and they'll say, look at its tummy or look here at its body. And it's impossible, even for a vet, to look at these photos and tell you what the cause is, because no matter what the cause of the dog's itch is, the skin can only react in the same way. So regardless of whether it's atopy or seborrhea or mange, all the skin can do really is get red, get itchy, and lose its hair. So this is just telling us that there's something wrong with the skin, but it's not telling us exactly what's wrong with the skin. And that's why it's quite dangerous as a frontliner to give advice based just on a photo. I know Dr. Karina is also on here, and she'll probably agree with me. As a vet, we would never, ever, ever prescribe any medication for any of these dogs without taking a full history, doing a full clinical exam, and making a specific diagnosis, because you can go horribly wrong with treatment if you don't know exactly what you're treating. Okay. Yeah, just shout, unmute yourself if you've got any questions at any point. So one thing I'd like to talk about is another big term for you to learn today is the pruritic threshold. So pruritic is just a different form of pruritus, the itchy threshold, the itchy limit. And so what we know is that every dog will have a limit that's shown by that line. So if we can keep the factors that cause their itchiness under that limit, then they won't be itchy. But if at any point we start exceeding that limit, then they do become itchy. So for instance, we might have a particular dog who's allergic to fleas, he's a little bit allergic to food, and he's quite allergic to grass, but he's going along just fine. And then all of a sudden, he gets an infection between his toes for whatever reason, and that will push him over that pruritic threshold, that itchiness level, and then he'll start showing itchiness. So then what we do as vets, we try and eliminate the factors that will cause the itchiness. So we treat the infection and try to get it underneath that threshold again, if we can. The other thing we could do is try and reduce the factors. So we could, for instance, treat for fleas, and within the first month, before the fleas are completely under control, we already get the animal under the pruritic threshold. So a lot of what we do when we're dealing with an itchy case is to try and figure out what these factors are, to remove them completely if we can, like taking the infection away, to reduce something as much as we can, and to stop the symptoms of itching. Because what also happens is you get this vicious cycle. The dog's itchy, and they're licking and biting, and then from their saliva, they infect the skin, and that makes them itchier, and they lick and bite, and they infect the skin. So we need to break that cycle to get the itchiness under control. So this is a very important concept for owners and us advising their clients alike. Okay, so we're just now going to dig a little bit deeper into atopy or environmental allergies. So this is the most common cause of itchiness in dogs. 90% of dogs that come into the consult room will have atopy and not food allergies. And that's very different to what the average client thinks. So they think that if their dog is itchy, it's allergic to food, but only 1 in 10 dogs that are itchy with an allergy will have a food allergy. So that's really, really important to understand that and to be able to guide the client on that. And we'll go into the food allergies just now. But atopy basically is got to do with the skin barrier. So this is a cross section of the skin where they basically cut through the side. So you've got different layers in your skin, and then your top layer has got an oily kind of layer on it. And part of the atopy is that that oily layer is disrupted for various factors, genetic things, and from itchiness and from chronic infections. Those sorts of things will affect the skin barrier, and that will allow your allergens or your pollens or dust mites or whatever it may be to actually penetrate into the skin. And then the animal's genetically predisposed to overreacting to the allergens. So normally your immune system is there to protect you from dangerous things like viruses and bacteria, but in an itchy animal who's genetically predisposed, basically their immune system's on high alert, and where a pollen should come into your system and your body goes, oh, it's a pollen, and gets rid of it, the pollen comes into the allergic dog system and it goes, oh my goodness, we're being attacked, and it launches this massive immune response, and a whole cascade of events happen, and it causes the animal to be itchy. And then because it's itchy, it starts licking, and we get that vicious cycle again. So it's really important to understand what happens so that we can understand how to fix it. Okay, so this is a little picture in a bit more detail, more on a chemical level of what happens. So all these little P's are pollens and other allergens. So they come through the skin barrier, and here's your T helper cell, which is one of your immune cells, who talks to one of your other cells. And when that little allergen attaches to it, it launches this massive attack on the pollens. And it does that by communicating through a whole number of what we call cytokines. So it causes a massive cascade reaction or chain reaction of different molecules and different cells that become activated that cause this massive itchy reaction. So if any of you struggle with hay fever, it's kind of the same thing. You know that if it's springtime and the pollen goes up your nose, your body literally launches its attack. It blocks your nose, it starts running, it's doing everything it possibly can to get rid of that allergen. And it's the same thing that a dog does, but it manifests more in their skin. And then if we get something like Staphylococcus, which is a bacterial infection, that also starts damaging the skin barrier and just creates more ways for those pollens to come in. So we really have to look at all these factors to get the itchiness under control. Okay, so when we look at management of atopy, there's 3 main things that we need to do. So the first thing is to try and repair the skin barrier. And we do that by using the correct shampoo. So we want some sort of shampoo that restores that oil layer on the skin to protect it so that the allergens can't get in the first place. So there we're really looking at 2 shampoos that would be worth using. So it would be something like ProSoothe and Alamile. If you could choose, I would go the Alamile route. It's a bit better, and it's also got a longer action. But price-wise, the ProSoothe is a lot more economical. So depending on what the client can afford, you go for one of these shampoos. The other thing that shampoo does is it helps to rinse the allergens off the skin. So if they're not, after you've gone for a walk with your dog through long grass, if you can rinse all that grass seed off the skin, then it won't cause that chain reaction. So they help not only with the skin barrier, but also physically removing the pollen from the skin. So it's really important just to use those two for an itchy dog. We don't want to use something like Sevederm or even a bacterial shampoo unless the vet has prescribed it, because they tend to be really drying and they tend to strip that oily layer off the skin. Oopsie, if we go back to this picture, they tend to strip that oily layer off, and it just makes it easier for the allergens to go in. So the only shampoos that we could recommend, that you recommend to an itchy patient, would be ProSoothe and Alamile, and that helps to repair that skin barrier. And then food as well. So where food would be a management tool for atopy would be Derm Defense or the new food Derm Complete from Hills. And what they have is very high levels of omega-3. So the omega-3 is the building blocks that the body uses to make that fat layer. So as you can see, it's a prescription food. We would not recommend that you change the food apart from that in an atopic dog. Ideally, actually, you only change the food once they've been to the vet, and I'll show you why. But those are the things that we use to repair the skin barrier. Then try and avoid the allergen. And as I said earlier, there's so many things that that dog is likely allergic to, but things that can really help is rinsing them after they've gone for a walk. And then we want to use lukewarm water. So if you use really hot water, you increase the blood flow to the skin, and then it's more likely for them to get itchy, and it also strips that oil off the skin. So lukewarm water. And sometimes you only really need to do the feet if they really get itchy feet and not itchy bodies. So that's something that's very useful. Flea treatment is a non-negotiable for allergy management. So if you remember that pruritic threshold, that little graph, it's quite easy for us to eliminate fleas, and often that just gets them under that itchiness threshold, and it helps bring a lot of control. So you all know about all our wonderful flea products that we've got on the market now. My favorite is still Brevecto, because it lasts so much longer and it's easier. But any of the flea products, long-acting flea products, will be fine. And then a bit tongue-in-cheek, Emigrate. So, that's the only way that you can really avoid the allergens in your area, but it's no guarantee that they won't be where you're moving to. Unfortunately, in the Helderberg Basin, we do have very, very high pollen levels, and we do find that a lot of animals and people suffer from allergies. So wherever you can, avoid the allergies. And then we need to control that immune reaction. So basically, this is all medication that would be prescribed by vets. And what our main aim there is to stop them from itching and stop that whole cascade of itchy or molecules that get produced that start the itching. So cortisone is quite an old school way now of treating allergies. We've got Apoquel and Cytopoint, which are amazing, that don't have the side effects that cortisone had. And they really do an amazing job, both Apoquel and Cytopoint. Within an hour of us giving it to the animal, they are already feeling better. So yeah, it's great if you tell your clients, our vets have new medications. They've literally come out in the last year to 18 months. So if they've been struggling with allergies and nothing works and they're so frustrated, it's worth recommending that they go for another consult, because there's new options. And then we sometimes use atopica and hypersensitization, but that's not as common anymore. Okay. Right, so we're going to just shelve atopy for a little while, and we're going to talk about food allergies. So if you remember right in the beginning, I said 10% of allergic dogs are allergic to food. So 1 in 10 dogs are allergic to food. And there's a huge amount of misconception around what a food allergy is. And I've seen it not only in the client, but also and frontline staff as well. It's quite complicated. So it's really important to realize that the dog will be allergic to a particular ingredient in the food and not the brand of food. And most of the time they're allergic to protein and sometimes carbohydrates. So there's been this whole big fashion of moving away from grains, and grains are so bad and dogs are allergic to grains, but it's actually the minority that would be allergic to grains. And most often they're allergic to protein, and very often it's beef and chicken. So if we want to try and eliminate food as an allergy, we need to change the protein and not just the brand. So it doesn't help if a client comes in and they're feeding Eukanuba adult food and you say, oh, okay, maybe they're itchy, let's try Hills, or let's try even changing to Eukanuba lamb and rice from the chicken, because there's still chicken in lamb and rice. So we need to be very particular about what we're doing with the protein and how we address that. Sometimes they have atopy and they have food allergies. That's when it gets really difficult for us as vets to sort that out. But the clue with food allergies is often the dogs are scratching the whole time, the whole year through. It can get worse at different times of the year, but they're always itchy. Whereas with dogs with atopy, they tend to be itchy in the seasonal pattern, most of the time spring and autumn. So that gives us a little bit of a clue. If the client says, you know, it doesn't matter what time of the year they're itchy, then we will think a little bit more about food allergies. But just to explain to you how food allergies work compared to the atopy that I showed you in the skin. So here basically you eat your food and it goes into your digestive system, and then the proteins get broken up into smaller little pieces, and those pieces are made up of even smaller pieces called amino acids. And then what happens is your immune cells got receptors for the amino acids in a particular pattern. So if you, for instance, say your dog is allergic to chicken, your immune cells will have the coding for chicken in the receptors on the cell. And then if your little chicken protein arrives and it binds to that cell, then the cell goes, okay, yeah, this is chicken, launch the attack. And then it starts that whole cascade of immune response and itchiness. And sometimes food allergies will present with vomiting, chronic diarrhea as well. So it can be a slightly different picture. Yeah, so there's a whole little, all the cytokines and everything that gets released for that attack. Whoopsie, just go back there, sorry. If it's a different type of protein and the little amino acids are different, then it won't attach to that immune cell and it won't cause that reaction. So that's kind of a very simplified view of what we would be trying to achieve when we treat a food allergy. So what we would do is we then put the animal on a hydrolyzed diet. So here they've now taken that little chicken protein and microscopically they've broken it. So the immune cell needs a little red square and a green triangle and a purple circle to attach all at the same time to cause that response. But because they're not attached anymore, it's unlikely for them to be able to activate this immune cell and unlikely to cause that reaction. And that's why we use a hydrolyzed diet. So that's like a very quick overview of how that works. But in practice, what does it really mean? So what happens is we get that patient in and we take a long history and we do a whole lot of tests to make sure there's no other things happening with the pet. And then we decide, okay, we think this animal has a food allergy, and we start a feeding trial. There are only 3 foods available on the market for doing a food trial, and all of them are prescription diets. So these foods are really only available to us as vets. And the foods that we're looking there are the Hills ZD, the Royal Canin hypoallergenic, and the Royal Canin analergenic. And now, yeah, so those are the 3 hydrolyzed diets basically. And then Derm Complete is also egg-based, which we'll sometimes use for a food trial as well. So the whole idea, then we say to the client, okay, we're going to see if your dog is allergic to food. So not only is the food hopefully a treatment, but it's also a test. And how we set up that food trial is we say to the owner, for the next 8 weeks, you may not feed anything to this animal except what comes out of this bag of food. And then we give them the bag of the ZD or the hypoallergenic. And I'm pretty sure everybody who has a dog on this group will be thinking like, it's virtually impossible to make sure that my dog only eats this food. I know with my dogs, it would be incredibly difficult because they counter surfers and they dig in the bins. And before I turn my back, they've stolen cheese from my daughter. So you have to be very proactive as a client to say, I'm making sure that nothing goes in my dog's mouth except this food for 8 weeks. Because every time they get a protein in their system that they're allergic to, then it starts this whole cascade of events. And then we start again from the 8 weeks. So it's something that has to be done in a very, very controlled way for us to know if the food works or it doesn't. And then the whole point of this very difficult exercise for 8 weeks is to see how the animal responds. So if they do respond and the itchiness goes away, then it's like fantastic, solved, food allergy, that now it's really easy to treat. And then we've got the choice of either continuing with that diet, or if it gets too expensive, we can try a novel protein diet like your DD or your Derm Complete or something like that. If they don't respond after 8 weeks and they're still itchy, then we know it's not food allergies. We know the owner can feed pretty much what they want, so long as we're supporting that skin as much as we can. And then we know we're treating them for atopy. And then obviously in that whole 8 week time, we don't allow the animal to suffer and itch. We are treating their itch, and we often treating their infections that come with them and so on. So it's a very tricky thing to diagnose and treat a food allergy. And what makes it even more difficult for us is if a client comes and you start explaining this whole story of how they now need to go on this very expensive food and it's a trial, then they say, but I've already changed the diet 3 times. I was at the vet shop and I just bought a new bag of something. And then it's very frustrating for us and for the client for us to say, well, that wasn't the right diet. You have to now throw that food away for us to be able to do it. And it's very hard for us to get buy-in in the first place to do this tricky food trial, but even harder if the diet's been changed a couple of times along the way. Okay, there's a lot of things, but basically just to give you an idea of what we as vets do, that when the client comes to you and says, my dog's so itchy, and you say, well, you need to go to the vet, and they say, oh, it's such a waste of time, and you can explain what we're actually going to be doing, and then they'll see the value in that. So first of all, we take a very long time. We always book a double appointment to deal with skin cases, and we ask them a whole lot of questions. When did it start? What's the pattern? What age, what breed, what are they eating, what haven't they eaten, what, all sorts of things like that. Have they moved? Have there been any changes in the environment? And then we evaluate the skin. So we do skin scrapes and hair plucks and sticky tape tests. We normally do at least 2 or 3 tests on each allergic dog. And we look for mites, we look for signs of infection, we look for yeast. So those will all be things complicating the itchiness. And then sometimes if we're not sure, we will do a biopsy. So if we're not sure it's atopy or something like that, we think it might be something else, we'll do a biopsy or we'll do a culture, because more and more we're getting very resistant bacteria that we need to treat. And then we will treat them with antibiotics or other medication. If there's infection, we'll give them relief for the itchiness as soon as possible, because normally by the time the dog's gotten to us, the owner's also going crazy because they haven't slept for 3 months because the dog keeps scratching. And then we'll look at shampoos, and we will discuss food and consider a food trial. But again, only 1 in 10 dogs needs a food trial. So we pick those dogs particularly. And then it can take a while to get to the bottom of it. So what we offer is free follow-ups for at least a month after we've seen the animals. So it's really important for us to get those animals back check them, make sure it's working, make sure the infection's clearing up. If it's not working, we go to plan B or plan C, and every single animal out there is different and will need different things. So it's really important for us to establish that relationship with the client and build up their trust. So again, the sooner we get the client to do this, the much easier it is to deal with the problem. If they've already been to 3 vets and gotten advice from 6 other people, it's really hard to get them to commit to solving their problem, and it does take time and it does take money, but the quickest way to solve the itch is to get the animal to us. Okay, so I just want to quickly talk about hotspots as well, because they can be confused with allergies, and I think as frontliners and vet shop staff, you probably get asked about hotspots a lot, and I know many shops stock Ricky's hotspot treatment and F10 cream and all those sorts of things. But I just want to make you stop and think twice before you sell something like that. So hotspots can be confused with other problems. And these are examples of pictures that people would bring in saying, you know, what's this? And you might say, well, that looks like a hotspot, and here's your Ricky's, and it will be sorted out. But actually, these are 3 different problems. So this one, yes, I agree, probably has a hotspot there, but most likely, if I'm looking, it's probably a Labrador, swims a lot. It's probably got an ear infection. So we can treat the skin as much as we like, but if we don't treat the underlying ear infection, the dog's going to keep scratching its face and it's going to keep getting a hotspot. So this dog definitely needs to be seen by a vet. This dog, it'd be difficult to say without checking, but I'd be very worried about an abscess in its tooth. So this dog needs to be seen by the vet, even though it looks like it's got a hotspot. It could be a tumor as well, which would be something we need to deal with soon because it's on the face. And this dog, I would be very worried about, because it looks like what a rat poisoning dog would look like, or a dog with an autoimmune condition. So this dog really needed to get to the vet yesterday, but all of them look like hotspots. So it's really, really important to for the well-being of the animal and for the client, and then for the reputation of you and the EvaVet group and that vet shop, to recommend that these patients get seen by a vet as soon as possible and not just sell them something. And I know that, you know, that goes against selling 101, but at the end of the day, the EvaVet group exists to promote long, happy lives for our patients. And by recommending that these sorts of cases get seen by the vet sooner rather than later, we're going to have that pet live a longer, happier life, and you have a client that trusts you and keeps on coming back. So you may not make that short-term sale, but you build trust with the client and you keep them coming back, which I think is actually more important than that sale, because it's nothing worse than you selling a hotspot treatment and only uses it for 2 weeks, and the dog's had a sore tooth, and it eventually gets to me and I say, oh, it wasn't a hotspot after all. So it can look quite bad. So please send them straight to the vet. Okay, so we've really spoken a lot about what vets can do, and the whole point of that is to show you that most of these cases do need to be seen by a vet. Sorry, I've got my own allergies while we're talking about allergies here. So what can you do? And we're going to run through a couple of things. So first of all, first and foremost, always any itchy animal to see a vet is going to be the quickest way to get resolution for the animal. And then got a couple of robots here, which I'm sure everybody understands, but green light would be ProSoothe. You know, if that person's really pushing you for something, or it's a Sunday afternoon and they just need some relief for the animal, you could sell them ProSoothe or Animile. A big red light for Sebaderm. So once again, that strips that oily layer off the skin and makes it more likely that the dogs will get the allergens penetrating the skin, and it's going to make the itch worse in the majority of cases. You can definitely recommend flea control, and that's so important. You could maybe recommend the Efazole. So again, that's if a client's really pushing you, but ideally you know, if it's going to help for the itch, it's going to take 6 to 8 weeks. So maybe we wanted to do a diet trial in that time, or we could get immediate relief for that dog within an hour. So is that really the right thing to be giving them in that moment? I don't think so. But it is something we do use to improve that skin barrier once we've got the patient under control, once the itch is under control. So you will definitely be selling Efazole, but it wouldn't be a first-line treatment. And that goes for Miracoat and Dermafocus and all those similar products. So yes, we do use these for skin cases, but ideally we need to know what we're dealing with first, and they form part of our treatment program. And then change the diet is also a yellow light. Just pause and think about it. Think about, will the vet maybe want to do a diet trial? Because if I change this dog's food now, it's going to make the job much harder for the diet trial. In the event, though, the only time I would say, okay, upgrade the diet is if the dog's not too bad, and you know that they're feeding a poor quality food, they're feeding bobtail or something that they buy at Builder's Warehouse or something like that. I mean, that's definitely not going to have the nutritional value that the dog may need. And in that case, upgrading them to a good quality food is not such a bad idea, but practice caution with doing that. And, you know, if the time allows, you can explain that it may not be a food allergy, and all animals that are allergic really need to see the vet. Okay. So that's my whole long, big speech. I just want to get all of you back up here. Let's see if I can figure this out. Right. Do we have any questions? You're welcome to put your camera on and unmute if you've got any questions for me.